Good evening, Mr. Yoda. My name's Kara. I'm going to be your nurse this evening. Before we get started, can I have you identify your name and date of birth? Mr. Yoda, 9775. Okay, awesome. So it looks like the doctor wants me to go ahead and get you started on some loratadine for your allergy symptoms. So basically, loratadine or Claritin, it's a second generation antihistamine that helps fight your allergies. So he wants me to go ahead and get you started on that, 10 milligrams. So I'm gonna go ahead and just take a look at your chart really quick. I see that you've been having sneezing, mild headaches, runny stuffy nose, sore scratchy throat, non-productive cough, runny eyes. Okay, so I've already taken a look at your labs. They look good. So some of the labs they might order for this person that is taking loratadine are their creatinine levels. You want to make sure that those are within normal limits, because one of the contraindications of this drug would be giving it to patients with impaired kidney functions, because this drug is anticholinergic, which dries them out. That could have potentially harmful effects on their urinary system. So your creatinine levels within normal limits. Another one would be their BUN levels, which is between 6 and 24. So let's go ahead and get your vitals really quick. We're going to want to take Mr. Yoda's respirations. Okay, respirations are 16, which is within normal limits. If the value was any lower than that, we would want to hold this medication, because again, it does cause sedation, which would cause his respirations to go even lower, which could be dangerous and fatal. Some other contraindications with this medication would be in patients with cardiovascular disease, glaucoma, hypertension, urinary retention, hyperthyroidism. So just a few extra things to watch out for with your patients. So before we administer the medication, we're going to go ahead and, Mr. Yoda, have you identify your name, date of birth for me one more time. Okay, 9775. Okay, so this is loratadine, 10 milligram tablets, oral, and it's nighttime, it's 9 p.m. So go ahead and take your meds. So with this medication, you're gonna always wanna take it at night, because again, it does cause sedation, which makes you drowsy. You don't wanna be driving or anything like that. You don't wanna be drowsy during your whole day. You want to take one a day, because the effects do last for full 24 hours. You can take it with or without food, your choice, but the doctor has you on it 1 tab by mouth daily until your symptoms completely improve. Some adverse effects you want to watch out for: sedation, so it's going to cause drowsiness, so you're going to want to avoid driving, avoid alcohol, only take at night, and like we mentioned earlier, anticholinergic effects. That just means it's going to dry you out a little bit. So you're going to want to make sure you're increasing your water intake. It can also cause constipation and thick mucus secretions. So again, increase your water intake and suck on some sugarless hard candies if you have dry mouth. Medication should start, you'll start to feel it start working in about 20 minutes after taking the medication, fully working in 1 hour. You won't feel completely better, but you'll feel a little better. Your symptoms should start improving within a couple of days. Some ways that we'll know that Mr. Yoda is getting better is that, well, first of all, his symptoms will improve. He won't have runny stuffy nose, no more cough, no more sneezing. He'll look better, and he'll also state that he has an overall better feeling.